Good morning, everyone. I'm redoing the video I just did on root canals and baby teeth because there was no sound and I don't know how to fix it, so we're going to redo it. I want to talk about the difference in a root canal in a primary tooth and in an adult tooth. I see a lot of moms talking in different forums and different groups about how appalled they are that their dentist recommended a root canal in a baby tooth. This is toxic. I'm not going to do it. They just want my money. And I'm glad that they're thinking about these things, but there is a significant difference between a root canal and a permanent tooth and a baby tooth. So first of all, the name. In an adult tooth, it is called a root canal. And if you've watched my root canal video, when the pulp is removed, it's packed full of gutta percha, which is a different substance than a baby root canal. So a baby root canal is called a pulpectomy. And the reason that they do baby root canals is to try to save the tooth, because that tooth is there for a reason, which is to hold space for the adult tooth that's going to have to grow in that spot. So in an adult tooth, we have really thick enamel. And it's designed to last us our whole life. So bacteria have to eat through a lot of enamel to get to the pulp of that tooth to cause us an internal infection, right? In a baby tooth, it's quite different. They have very thin enamel and very large pulp chambers. So it is really easy for bacteria to eat through the enamel, get to the pulp, and cause systemic issues. So it can cause a child to go septic, it can cause a blood infection. Decay in a baby tooth gets really serious really fast, which is why your doctor is going to really encourage you to treat this tooth if it's a baby tooth. When a pulpectomy is done on a primary tooth, they remove the pulp of the tooth and they pack it with what's called eugenol. And eugenol is, it's got antiseptic qualities, it's antibacterial, it has a numbing agent to it, and it's made from cloves, which is one of the reasons that people use cloves for dental pain, because it has that kind of a numbing anesthetic effect. So it's quite different than the gutta percha that they pack an adult root canal with. Also, the crowns that they use are completely different. In an adult tooth, it's either PFM, which is porcelain fused to metal, which has some toxicity issues in my opinion, or it's a CERAC crown. In a child's tooth, it's a stainless steel crown. So there's no mixed metals, there's no mercury in it. It has a very low incidence of people having any type of issue with it. It's a completely different material. When I was in dentistry, I used to have to help try on stainless steel crowns for the dentist. They would seat the crown. That was not legal for me to do, but they would have us try them on. And what you do is you get a big box of stainless steel crowns. It's all stainless steel. So if your doctor is recommending a pulpectomy, consider this to keep space for the permanent tooth. It's very important that that permanent tooth has a space to grow in.